I'm Mark Swendsen. I'm the Chief Revenue Officer for Forum Biome, and I'm here to welcome you this morning and to just orient you on what today is about. These are our speakers. I want to give them a round of applause and thank them for coming and actually being our participants today. We're also going to be referencing a working group. That working group is a working group that you can see some of the people from this team are on, which is a working group for helping to create standards in AAV NGS characterization, definitions, best practices, et cetera. And all of you are here today. So first of all, I'm very happy that you're all here today. We've got a diverse and powerful group of people. You can see just from the logos up on the screen here that you're surrounded by your peers. Who we are, I've got one slide on us, which is we provide a computational approach to designing therapeutics at a fraction of the time and cost, right? Our focus is speed and predictability. We feel that we are the in silico partner for AAV gene therapy companies. And this session is about providing a platform and a format for collectively innovating in the space. What we see in the space is that there is a lot of good news. You see that as of October 2024, there were 38 FDA-approved cell and gene therapies. Breakthroughs are happening on a constant basis. We are cracking the code on manufacturing. We're navigating the evolving regulatory frameworks. And this is from Tim Hunt's session at meeting on the Mesa. This is not part of his session this afternoon, but I want to highlight some of the things that he points out, which was funding. Funding for the first half of this year is equal to the funding for the last 2 years in terms of where it is to date. So it looks like we're starting to come out of the woods from this funding winter on the cell and gene therapy side. And also, I think part of that's maybe underscored by the fact that some of these cell and gene therapies have a 2.5 times greater chance of getting approved than some of their comparable other therapies. So great news, but also we're still struggling. And I think some of the places that we're still struggling is the complexity of the manufacturing process, the risk of toxicity that we're seeing. And this is not isolated data points. These are places where I think we're seeing pretty consistently. These are concerns for the industry to address in general. And we see kind of 3 pillars of this stool that as an industry, we need to address. The first is development. This needs to be faster. This needs to be more efficient. We're seeing that on the manufacturing side. We need to be better. We need to actually have kind of better scale for how we're approaching this. And at some point, we need to crack the code in terms of actually working with payers. Today's session is really talking more about the first 2 legs of the stool, maybe not so much the payer section, although Tim Hunt will actually talk a little bit about that in his session at the end. Our focus and our thought on this is that the way that we can help complement the initiatives and the drives of the industry is helping provide that digital infrastructure that is supporting and buttressing your science. So with that, we'll kick off today.